Hi, and welcome to Good News Friday. Mike Simon is here. I'm Joey Yarber. Welcome in, everybody, and thank you so much for giving us some time to talk about things that we hear from people that we talk with throughout the week. There's a lot of passionate folks out there, and it's always our privilege and honor to speak with many of them. London, England, the site for two gentlemen that we talked with this past week. And it was a delightful conversation, Mike, because they're working from a perspective of after crisis care. Whoa, what happens after someone gets discharged from a healthcare facility, a hospital, or an agency that's working from that care perspective? The crisis has been met, right? That emergency need taken care of. Then they're discharged, but the need does not go away. That help is still needed for this individual. These gentlemen were talking about the issues that's going on in the United Kingdom right now with mental health. You have a patient, they go to the hospital, they get that immediate emergency solved, but then they're discharged. What's going to happen with them? Are they going to get that aftercare need and or help that they so desperately need? Sometimes, especially in a mental health crisis, we're talking about someone that may be suicidal. We're talking about if they don't get the kind of help that they need, that life may not continue. This is how desperate that the times are. And when there is no agency that's coming in to help with that, it is a very sad situation. We have a service gap that's going on. And what we need to be able to focus in on is from a referral perspective, the hospital out to an agency that focuses in on mental health in the community, right? So that there's a handoff of, here's this patient. We have provided all the help we can here, an emergency room crisis here for the hospital. But this person is just getting started with what we need from a step perspective, setting up goals and getting this person to a place of sustainability. Mike, it is that case that they presented to us here at CharityTracker. We can very easily help with our request and referrals feature.
Well, I like what Dr. Tom Wolfe said in his book, The Power of Collaborative Solutions. Somebody asked him, he said, well, what's the biggest problem in healthcare out there? He goes, an ineffective referral system. And he says, from his standpoint, when people leave the hospital, where do they go? And who's going to help them with long-term care? The social services, the health nutrition, food, clothing, and all that. All the hospital does is they do very well is to cure the sickness or the illness, or do something to get them out of crisis care.
Right. And
then when they're no more in crisis, then they send them home. But who's going to take care of those people when they get out? And that's what we're seeing a lot of healthcare doing now. They're trying to figure this thing out. And the answer is an effective referral system. And so who provides an effective referral system? Well, we can.
Yes.
Now, it's not an easy task because it means you got to get people to working together for common good and greater impact. And that's like herding cats. But, if you can get them together, boy, do you have an effective referral system.
Yes.
And then people get the help that they need.
Mike, it's so important that we're able to put everyone on the same page at the same time. And working from that perspective, you talk about it so many times before, it's so ineffective when you've got that single focused approach. It just doesn't work. We have to bring in partners within the community. As we look at healthcare nowadays, it is a specialized focus, and that is what it is, right? But what if we can bring in a specialized focus from a community type focus of being able to refer? So this person they're not getting everything that they need from this agency. In this case, a hospital. A hospital can only do so much, but then they're working from a perspective of the community type focus of when that person is discharged from their room at the hospital, they're going directly to another healthcare facility that is focused in on mental health. They specialize in that. Now we're actually able to do a handoff that is respectful to the patient, to be able to get them the kind of help that they need moving forward after the crisis, long-term care. And let's say hypothetically that healthcare mental focused agency isn't able to provide them with food, isn't able to equip them with housing, those kinds of things, moving out of that particular facility. Still using the referral mechanism, being able to search for an agency that can help with food insecurity, and then being able to work from a housing perspective. Now we're setting it up to where it's long-term sustainable care for an individual that is in need. All along the while, all these various agencies keeping track of that data. We got a good chance. We got a good chance.
I know two consultants that said it a few years ago, that it is in the best interests of nonprofits to work together. Absolutely. To provide a more comprehensive approach to meeting people's needs. And these two consultants said it increases the capacity of the individual nonprofit to be able to refer them to someone who can meet their needs. These nonprofits out there, they can't be all things to all people. And you can't ramp up a handful of nonprofits in your area. You may ramp up 6 or 7 and say, we're going to give you more money and we want you to produce more programs, and you'll help more people. And it just doesn't work that way because the nonprofit is only limited to its program and services and limited staff. And so the federal government found out that does not work.
Yes, sir. So
the federal government now is even looking at that. They want a more comprehensive approach to meeting people's needs. That's where a CharityTracker comes in because it gives individual organization a chance to do their thing. And they can ramp that up, that thing that they do. And it may be specialized, but then when they partner with another nonprofit that does a different thing, then they can merge together. And now they're providing better services for the people in need. And so this is what this is all about. You want people, the whole system of effective referrals is to make sure that people are better served. And the way you can do that is so that the nonprofits are better engaged and informed. And then the last thing is that your community is better engaged. And when you got that all engaged, then you bring your funders in. Your funders are ready and willing to work with nonprofits that are willing to collaborate with other nonprofits and bring the solution, not the service, to the table. Bring this solution of offering people a more comprehensive approach to community care. And that's what CharityTracker does, and it does it great.
Mike, you termed it comprehensive coordinated care. It works. And it is with that kind of goal that we see agencies like these gentlemen from London that was talking about the challenges that they have in the United Kingdom. And I just shared with Shuli, the gentleman I was speaking with, the same situation here in the United States. We've got to equip our communities to work together. The healthcare agencies within the community, that's life and death many times. We've got to equip them to be able to work together and be able to get the kind of help, the kind of care, true care that an individual needs. Comprehensive, coordinated care. It can happen with CharityTracker. The request referrals feature, Mike, that is gold. No service gaps, no cracks. No one's falling through the cracks that we talk about sometimes, and it happens. Even the ability to see once an agency refers a patient to another agency, you can see if ultimately that need was met. So it's that ability to really know with peace of mind that person that you sent to another agency really did get the help that they needed. Or if they didn't, that you can follow up with them and then try to get them more help and working from that component. But it's something that's so important. And hearing from the gentleman there in London about their work and what they're looking to do from a mental health focus, we all need to just dive in as to what we can accomplish with that. Because if you're really going to have effective transformation, hey, we got to work together. We got to get it together. CharityTracker and all of us here at Simon Solutions, we're committed to help with this endeavor. So give us a call, Mike at simonsolutions.com. You can always get in touch with him or Joey at simonsolutions.com. We're in this for the long haul, folks, as we bring this solution, this resource tool into communities. We're looking to solve some of these challenges. It really is life and death. So, hey, if we can talk, if we can help, please know we're with you every single step of the way. For Mike Simon and all of us here at Simon Solutions, thank you so much for the passion that you have and for allowing us to serve with you out there and transforming people's lives. Take care, everybody. Have a great weekend.